a hypertonic inframedial orbicularis oculi muscle. That basically means your eyes are slightly narrowing, which is also associated with aggression. So what are the points of expression that we can modify? Now the most obvious, of course, is the one I've already mentioned my older patient had, which is frown lines. We all treat frown lines on most days, but we also have some more subtle and interesting signs of negative expression, which I'm going to cover. The second is descent of the lateral eyebrow. So this is associated with a sense of concern. Heaviness at the side, particularly frowning in the middle, makes patients look concerned. This also happens as you get older because your brow naturally descends. There's also a combination of the two. In fact, this has a name in psychiatry, which is the Amiga sign or the Varaguth sign. In the early 1900s, Otto Varaguth actually described this pattern of lines in the forehead and pointed out how it was often associated with grief, sadness, and depression. Tear troughs also appear, and this, I think, sometimes makes patients look angry. Have you ever noticed how tear troughs make people look angry? Usually we think of it as a sign of tiredness, but I actually noticed this once when I was seeing a picture of Theresa May, and she looked very angry, but she wasn't frowning. And I realized that when you tilt your head down, which is an aggressive posture, this normally highlights your tear trough, which we interpret as aggression, when in actual fact it could just be a depleted fat pad. Number 5 is an interesting one I only recently spotted. A hypertonic inframedial orbicularis oculi muscle. That basically means your eyes are slightly narrowing, which is also associated with aggression. The narrowing of the eyes is simply caused by loss of a fat pad, which can be at the lateral lid cheek junction or the cheek, and we can of course restore that. Number 6 is the nasolabial snarl. So it gives a sense of disgust or anger when this muscle is pulling up and casting a shadow, because it's also one of the negative expressions that we do. This happens as you lose volume in the midface. Number 7 is pursed lips. So these are associated with anger as well. You can see it in children and that makes it much clearer, or adults, but adults get it just when they've lost volume in their lips, and the hypertonic orbicularis oris muscle simply makes that look more obvious when they're actually not feeling negative. Number 8 is the downturned mouth. So just a sense of grumpiness or sadness caused by a shadow, also by increased tone in the depressor angularis oris. Number 9 is a more subtle sign, which is the chin crease. If you think about a grumpy child, for example, they rotate their chin upwards and the lip down, and this creates a sense of grumpiness, which also in the adult, if they have a crease that's left there, gives a subtle sign that they are in a negative state when in fact they are not. Number 10 is the jowl. I think sometimes the jowl creates a sense. If you imagine someone sulking, there's a heaviness to their midface, and a jowl can create that sense in people who are not feeling that way. These are all the signs of aging that naturally cause a negative aura. Isn't it sad that aging doesn't make you look happy? It makes you look sad, and this is a risk to our patients' health.